Welcome to the press briefing. On stage, we have Dr. Chung Chuk Kwan, Head of Communicable Disease Branch, Center for Health Protection, as well as Dr. Sarah Ho, Chief Manager from the Hospital Authority. Dr. Chung will report the situation of the epidemic to us. Thank you. Yesterday, we had a total of 1,186 confirmed cases. Confirmed through PCR 435 cases, and those who successfully registered with our online platform and tested positive by RAT 751. We have 141 imported cases. One detected directly by PCR, there are 114 cases, and those reported to our RAT 27 cases. Now, in the fifth wave, we have 1.21 million, 5,380 cases. Among the 41 imported cases, 72 were picked up upon arrival. 32 arrived on the 19th through 12 flights. 36 cases arrived on the 18th. On 13 flights. 46 cases were picked up at quarantine hotels. 27 cases picked up on day 7. All of them with very high CT value. Some were were picked up when they left Hong Kong, and they were negative by that time. They have also already left Hong Kong, and they appeared to be positive cases. For death cases, one more reported by the Hospital Authority in the fifth wave. 9,105 reported by HA, 9,183 cases, 3,790 female, and 5,383 male. For care homes, today, we've got 4 care homes reported cases to us, 3 of which had 1 case each. 1 or 2 have 1 resident respectively, and their close contacts will be sent to quarantine. Another care home involved a worker, and he is isolated, and close contacts are under quarantine. We have 1彩霞居松山府第 5 cases report to us in the morning and the afternoon. A total of 5 cases, all residents of the home. In March, they had the last case, and we started investigation. I think a group of the residents will be quarantined. Now for schools, we have 408 positive cases. In fact, 108 tested positive this morning. 125 tested positive yesterday. 108 cases tested positive on Saturday, and 67 tested positive on either Friday afternoon or even earlier. Among these 408 cases, 335 students and 73 are teachers from 289 schools. 65 KG cum CCCs, 197 primary schools, and 144 secondary schools, and 2 special schools. Among the 408 cases reported over the weekend, now for these cases, in the past 7 days, 130 schools had 2 or more cases. Most of them had 2 cases, and many of them were not linked. We have examined and analyzed the cases, and we've recommended the following 6 schools with individual classrooms to be suspended. One is in Chai Wan Catholic Primary School, Chun Wan Catholic Primary School. On Saturday, the 18th of June, a few students in Class 5C were reported. So far, 5 students, all from Class 5C. The class have a total of 29 students. We suggested on that day that this class should be suspended for 1 week. This morning, from Class 3D, 3 students tested positive. Class 3D has got 28 students who have also advised that these 2 classes should be suspended. They should suspend face-to-face classes. And St. Stephen's College in Southern District, one of the classes had 3 students tested positive in the last week, and today is the 3rd student, Class 5Y, with 20 students in total. So this class should suspend class for 1 week. And CCCK1 at Aldrich Bay, Class SC, has got 30 students and 4 students tested positive. Again, this class should be suspended. St. Benedict student at Choi Hong Estate, Class 3A, with 23 students, 5 in total tested positive. Again, this class should be suspended. Hong Kong Wai Nga 學校 in Southern District, 3 students tested positive. Class 7B. 3 students reported to us tested positive, so this class should be suspended for the time being. Another one suspended earlier. And HK FYG Lee Shao K College, 1 English class, 1B and 1D, or 2 cases in total. So we asked, actually there should be 3. We asked that English class be suspended for 1 week. In Class 1B, not from the English class. I have another 2 students tested positive, so that has brought the tally to 3. We also suggest that Class 1B should be suspended for 1 week. Now for the mutant strain, for BA.2.12.1 imported cases, as at yesterday, we have a total of 190, BA.4, 34, BA.5, 62. For local cases, BA.2.12.1, a total, now including suspended and suspected and confirmed, 211. We have 4 more suspected to be BA.2.12.1, all carrying BA.345Q, linked to previous cases. 3 were picked up at quarantine center because they have family members positive. Goa, they live in Goa Dai Ha, another in Big Hai Lam Teen Block 5, another at Oscar by the Sea. 1 lives in Sai Kung Mok Che Che. He also works in the control center of the airport and Area D. He worked in areas A and B. He drives a vehicle there, so he might have had some contact with personnel in Area D. And all personnel in Area D has been tested, and we've asked that people in Area A be tested again to pick up whether there is any related cases. Other cases and other outbreak, we do not have any update. That's all from me today.
Dr. will report to us about the situation at the HA. So far, we have 846 confirmed cases staying at the HA hospital, 67 of which are newly confirmed cases. Those who need to be admitted to the isolation ward, 157 are in isolation wards, 10 staying in Tier 2 isolation ward. 110 patients are staying at the North Lantau Infection Control Center. 57 are newly confirmed cases. Yesterday, there was 1 reported case of critical conditions, and there is 1 new case of patient in serious condition. At the moment, we have a total of 16 patients in critical conditions, 9 serious. 3 of the patients in serious are in ICU for treatment. Yesterday, we reported a 53-year-old male who passed away. He did not come from an elderly home, and he also had received 2 vaccines. On the 18th of June, because of cardiac arrest, the patient was taken to the A&E ward by ambulance. When arriving at the A&E ward, he was already in a very serious condition. The medical staff, carried out emergency rescue and tried to resuscitate the patient. He was subsequently sent to the isolation ward for further treatment, but his condition continued to deteriorate. And then in the afternoon on the 19th, he passed away. The patient suffered from colon cancer. Well, this case has already been referred to the coroner for further follow-up. Over the past day, 41 patients have recovered. 32 have been discharged. During the 5th wave, we have so far 51,260 patients who have recovered, including 50,873 who have been discharged. Since early 2022, we still have 636,345 patients who have discovered, 63,253 discharged, and we have 3 patients who have been identified, and 4 close contacts have been confirmed. So far, we have at the HA, we have 23,882 staff who have been confirmed positive, and 23,763 have returned to work. Recently, we have patients in stable conditions. While the number of patients admitted to hospital has slightly gone up, but those who needed to stay in isolation ward or those in serious or critical conditions, the number so far has not gone up significantly. So far, it is still at a stable level. So far at the HA, the supply of manpower and hospital beds are sufficient to cope with the situation. But we are not letting off our guards. We have actually enhanced our contingency, and we have instructed the different clusters to be developed so that in each and every cluster there will be sufficient beds so that we'll be ready to admit any new patients. If there is a large number of patients who need to be hospitalized, the different clusters can deploy thousands of hospital beds to admit patients so that we would have sufficient beds ready to admit patients. So far, at the AWE, while it is in standby position, but we will be able to, within a few days, start readmitting patients again. The North Landa Hospital, Infection Control Center can also be ready to admit confirmed patients within a few days. Other than hospital beds, we have also made preparation in terms of our manpower. Different hospitals have already, come up with a roster system where we would be able to deploy a large number of staff to look after the patients. I'd like to remind the public again that in the face of the changing status of the epidemic, we hope you will not let off your guard and continue to stay away from large gatherings and observe various infection control measures. Try so that we can actually suppress the transmission of the virus and that the number of cases will continue to decline. It's now Q&A time. Please put up your hand if you have a question.
Okay. Please identify the organization you represent when you ask questions. This lady, I'm from Cable TV. Now, with regard to school cases, today we have 6 classes from different schools suspended. Now, when there is a case in a class, that class can be suspended, and then there may still be cases in other classes. Does that mean that suspension of one class will not stop the spread of the disease? Will you consider suspending the whole school? Now, for isolation measures, since implementation of the new measure, that is, if family members share the same bathroom, then they have to go to isolation facilities in Penny's Bay. I'd like to know how many have been sent to Penny's Bay since, and will it be saturated? We are according to observation. It's not that the disease has spread to the whole school. Now you can imagine, although today we have hundreds of cases, actually there is just 100 or so cases tested positive this morning. We have close 730,000 students and over 100,000 teachers tested by RAT every day. And today only schools have got individual classroom classes to be suspended. We have suggested that they suspend class for a weekend. We have not seen any outbreak there. Perhaps in some schools, there is contact between two classes, so a couple of them might have to be suspended. I think this measure is effective. I don't have information on the occupancy rate of the isolation facilities. This gentleman here. With regard to schools, you mentioned a few schools and also the total number of students affected. Waiya House 7B and Leishiu K College. Can you tell us the total number of students in these classes? Now, Class 1B of Leishiu K Hospital, is it that they have got 3 students? And for the Chaiwan or Chunwan Catholic School, are classes 5B and 5C linked, or is just coincidence? And regarding the emergency measures, contingency measures, will A and GOPC be closed as a result of your contingency plan? And I'd like to know the utilization rate of designated clinics. Now, it is said that RAT cases will be verified by PCR. I'd like to know whether you're able to achieve 100% verification. What is the ceiling of your capacity in terms of verification? HKY, FYG, Lee Shao K College, 28 students in 1B. There are 3 students infected so far. Chaiwan Kok Catholic Primary School, we have to conduct investigation to see whether the 2 classes are linked. We have to put in place control measures first. So far, we can achieve 100% verification of RAT reported cases. We'll see whether there is any need for further follow-up. Which school? Oh, the 5th school. 19 students in class 7B with 3 cases. HA has got 7 designated clinics to support patients in the community. Of course, we will continue to monitor the demand for services and also the development of the epidemic. If need be, we will adjust our services to meet the demand of patients.
Next one. Thank you. Now, TV. First of all, I mentioned just now that there are 5 cases. Could you give us more details? So how many of them have to be quarantined for those 5 confirmed cases? Did they live in the same room, in the same area, or did they live in isolated wards and became infected? Secondly, regarding the elderly care homes, is it that for some of the elderly care homes, you have people confirmed in different homes? Is it like the 5th wave? There will be a collective outbreak of collective infection. And will there be any measures to prevent that? And secondly, regarding this morning, the media reported that we have a celebration activity to celebrate the unification, and the students have to be quarantined in a hotel. Can you ensure that people who participate in the celebration activities will not be infected? Regarding the elderly care home, the 松山府第 elderly care home, well, the case was just reported to us, and we're still investigating into that case. So far, 44 close contacts would need to be quarantined. Of course, we would need to look further into the case. Actually, for the elderly care homes, during the fifth wave in February and March, there was a serious outbreak, and the vaccination rate at the time was relatively low. Many of the elderly residents became infected, and they have immunity subsequently. Also, there's a lot of vaccination in the elderly homes, so that we're able to maintain the immunity of the residents, so that there won't be any large-scale outbreak. For individual care homes, some of the residents, their immunity, since they became vaccinated in March, the immunity level has dropped, and some of them have become infected, and hence there is transmission. So for those living in the elderly care homes, if they have not yet get the required number of vaccination, they should do so as soon as possible. Now, regarding I think our purpose is to cut down on the transmission. I'm from Mingpao Daily. Regarding the overall state of the pandemic, some experts said that with the passage of Father's Day, and many people actually celebrated the Father's Day, and there might be, a rebound in a number of infected cases. So how is there a need to address that? And secondly, regarding the elderly care homes at the 松山府第 or the Longevity Palace Senior Lodge, when did those residents became infected? When was the onset of the disease? When were they first tested positive? Did they have any previous infection record? And also, for the other, what are the names of the other elderly care homes? And also for the Longevity Palace Senior Lodge, will there be more cases of infection? And secondly, regarding vaccination for children, CDC of the United States earlier had cut down on the said that the 5-month requirement for children taking the vaccination. Will Hong Kong be implementing a similar policy? And does the CAP believe that the vaccination rate at the moment is already enough to cut down or to reduce the risk of infection? Regarding the residents of Longevity Palace Senior Lodge, 2 of them were reported to us in the morning of the 19th, 3 in the afternoon on the same day. As to the onset of the infection, we need to confirm each one of those cases, because for the elderly, it's not so easy to verify the day of onset. So for this home, there were early infections in March. So it's possible that some of the residents had already been infected early on, and they have been reinfected after 3 months. As for the names of the other homes, one of the homes was the Ho Sin Hung, Madam Ho Sin Hung Elderly Care Home with the staff, and then you have the 善怡福群護老院 in Yau Chim Mong, and there's another one called Phúc Thai 護理安老院 in Tuen Mun. I think regarding the state of the pandemic we are now seeing that the number is gradually climbing, but it's not like during the fifth wave when we have a rapid rise in the number of cases. Within 3 days, the number doubled at that time. But now we are seeing the number doubling within 4 or 14 days. This could be due to the fact that more and more people are now have the immunity, and also more people are now vaccinated. As to the question is by how much would the number go up and when would the pandemic subside, it's very difficult to estimate at this point. Your third question was, oh yes, I think in Hong Kong we already have a mechanism. Should a new vaccine be available, and if an application was submitted, and we have a committee within the government to consider the application, and for example, whether or not the COVID vaccine is suitable to be administered for children, and then the scientific committee will discuss that further. My understanding is that we don't have any updated information in this regard. Next, Economic Journal. Regarding the import cases, we have more than 150, which is the highest during the pandemic. Is that an alarm bell? And you say of the 27 imported cases, they only confirmed 7 days upon arrival. Had there been any such cases with a high viral load? Some experts say that after Father's Day, there will be a marked increase in the number of infection cases. Have we seen any sudden surge in the number today? And also for the HA, you suddenly said that you now have the preparation ready, or the contingency measures in place. Are you expecting that there will be a rebound in the number of cases, and how many hospital beds have you made available for contingency? For BA.12.1, yesterday there was 215 hours, 210 today. For the imported cases, we have 141 today. It's a high number for imported cases. We've looked at each of the cases which were tested positive 7 days after arrival. Most of them, the CD value was more than 30. For individual cases, the CD value was lower, some in the 20s. And many of them involve local activities, so it would appear that they were infected locally. We will, conduct further genome analysis, genome sequencing analysis to see whether they are linked to some of the imported mutant strains. I don't have the figures for the RAT figures yesterday. For BA.2.12.1, for example, if there is L452Q, or if someone is already confirmed BA.2.12.1, Dr. Au was talking about some linked cases, say the family member will confirm cases, but they were not able to, conduct, the viral analysis yet.
In the past couple of weeks, we see a gradual increase in the number of confirmed cases. Well, at the peak of the fifth wave, we reserved 11,500 beds for confirmed patients. As the situation eased a while ago, some of the beds have been used for non-COVID patients. Recently, we have directed clusters there in the past couple of weeks because there was a slight increase in the number of cases. We advised clusters to be prepared. Should there be a resurgence of cases, we will be able to have beds ready for patients, and that's why we have made this announcement today. Well, in the past 2 weeks, in the past 2 weeks, we have seen a slight increase in the number of confirmed cases, but for cases requiring hospitalization, the number of serious cases, the situation is stable. Admitted patients are not in serious conditions, and they are stable. So we just want to be prepared. If there is a turn for the worse in a short term, we will be prepared. No other questions than the PCNs here. Thank you very much.